And joining me now is BC's Health Minister, Adrian Dix. Nice to see you, Minister.
Hey, good morning, Rosemary.
So I know that there's a lot going on across the country right now, but obviously in your province, you've had to introduce new restrictions in parts of the province, in Metro Vancouver particularly. Did those restrictions come too late, Minister?
Well, we understood in the summer that November and December were going to be very difficult. This is the first time we've had COVID and respiratory illness season. We didn't know what the effect of this time of year would be on COVID, but clearly it's very serious here and everywhere else. So in the summer, we hired a massive group of contact tracers in this time to work and support our contact tracing, and we continue to do, even in difficult circumstances, case management here in BC. Mm-hmm. We substantially increased the amount of flu immunization we were doing. We prepared our hospital system and so on, and still this is an enormous challenge and has required some public health action in addition to that. What we've tried to do, though, Rosemary, is learn from what happened in March and April and May, that actions have consequences. And one of those areas, for example, is the overdose public health emergency in BC, which became significantly worse in the first months of COVID-19.
And I'm glad you brought that up, because I will get to the opioid crisis, which is sort of the other part of this that you're handling. But to go back to COVID for a moment, it did seem during the spring as though British Columbia sort of got a better handle on things faster. And now you find yourself sort of in the same situation as many other parts of the country. And I'm wondering if something is it just a confluence of events? Is it the season? What has happened to your success story in British Columbia?
Well, I think in an important area, which is mortality rates. As you know, BC, of the 27 jurisdictions in North America with 5 million or more populations, so our kind of equivalent jurisdictions, we have the lowest mortality rate from COVID-19 in BC. And in comparison, in November and in October, that's continued to be the case. So our hospitals and our healthcare system and our long-term care system is struggling because these are huge demands. And we've also had extraordinary tragedies ourselves, but relative to really all the jurisdictions in North America, we've done well in that area. But we're seeing more general transmission across British Columbia. It's not uniform. It's principally in the Fraser Health Authority, which is the suburbs of Vancouver, and the Vancouver Coastal Health Authority. And so we've had to take some significant action in the last 2 weeks. What we've seen is that it's events at home that are the significant problem. And we're entering into a period with Diwali, with Hanukkah, with Christmas, with New Year's, where we're going to see a significant number of those. So these actions are necessary. And right now in British Columbia, we're asking people to only socialize with the people in their households.
You talked about layers of protection. One of the layers is the federal government's, the country's COVID alert app, which BC has still not taken on. I know you have invested heavily in contact tracing. You talked about it right off the top. But if this is about layering on protection, why not just take up the app, Minister? Why not just use it as another layer of protection for people?
So in British Columbia, on issues such as this, which are essentially medical issues, right, we take the advice of our public health teams. And our public health teams have recommended that we not do that at this time. And they've worked with the federal government. We haven't given up on the process. We hope to see some changes to improve it. And really our goal is for it to be positive and not negative. And so, and that's what we're continuing to work on. We're not, we think there's a significant role that can be played by apps in a general sense in assisting us with COVID-19, but it has to be positive. And our experts, the people who we depend on to deliver this, have strongly recommended to us that we not proceed at this time. It's not a political question in any way, shape, or form, but we are going to support them when they make recommendations like that, and they have.
What do you think that for people, maybe it's not the same across British Columbia, but do you think that Christmas as a celebration, or Hanukkah, or whatever celebration people are gearing up for in December, that it is off the table at this stage?
No, I think it's, I was on Remembrance Day, my wife Renee and I went outside, right outside from here, and we stood in a park and honored those who lost their lives in war. And what we found was that people around that park, physically distant, were doing the same thing. It was very moving. I always find Remembrance Day ceremonies moving, but that was very moving, right? And we did a number of other things like that. Christmas as a religious celebration, as a cultural celebration, will continue to be fundamentally important. And I think by staying apart this year, by not coming together, that Christmas is not about Christmas parties. It's not about drinking alcohol. It's not about all those sorts of things. It's for some people, it's a religious celebration. For others, it's a cultural celebration. We're going to have Christmas this year, but it's going to be different, and we have to be prepared for it to be different this year. And that means making sure that we keep our own bubbles tight.
I want to ask about the opioid crisis. The deaths from deadly overdoses in British Columbia still outpace the number of deaths of COVID-19. As you say, you have a low mortality rate for COVID-19 in the province. I did get a chance to talk to the parents of 21-year-old Olivia Dalton from Langley, BC, so Lisa and John, about their daughter who they lost to a fentanyl overdose. I want to play you just a little bit of what they had to tell me, Minister.
She was unable to attend her NA meetings and her AA meetings, which were very important to her. It was a very large group of supportive people. And unfortunately, with the pandemic and things having to shut down, losing touch with a lot of those people or being able to attend the meetings really made her feel isolated.
COVID-19 seems to have taken center stage lately over the drug addictions that are going on. But I still believe that the drug addictions are taking more lives daily than COVID is right across Canada.
So what do you say to those parents, to John and to Lisa, Minister, parents who feel like the opioid crisis, which killed their daughter, has been completely, taken over by COVID, and they are bereft, and there are many parents like that in British Columbia and indeed across the country?
Well, first of all, to say it's obviously a terrible set of events, and so I really admire them for speaking out and being and having their voice heard, because it's important that we understand in a personal way the cost of the overdose crisis. We've had a public health emergency for the overdose public health emergency since 2016 in BC. We've invested massively in it. Until COVID, we were having some significant success in reducing mortality from overdoses. But since COVID started, one, the drugs became more toxic, and that was dramatic. And two, people became more isolated. There is no question about it. And so we went from reducing the number of overdose deaths we were having to some of the worst months we've ever had, 171 deaths, I think, in May, 175, then 175, which is profound. Right? Yeah. And so we have taken very aggressive steps, and we continue to.
Do you think you can make up that time? If you started off and you were getting better, things were progressing, and now it seems like everything has fallen apart again and it's gone backwards. And given we know the strain it's having on people's mental health, do you think you can make up the progress?
Well, I think we're continuing to make progress in the measures we're taking, but the circumstances have got much more difficult. Yeah. And it's not, I think some people have tried to say, well, is it COVID-19 or is it the overdose public health emergency? It's both. We're dealing with them both equally, and they have an impact on one another. And what we've discovered, I think, much more so than we might have expected, was the initial impact of COVID-19 on the overdose crisis was profound, but it is a massive top priority of our government, and I know of people in BC, because they know that in every part of BC, it's their children and their co-workers who are affected. So but we have two public health emergencies, and they both deserve our attention, as much as the other.
Okay, Minister Dix, you're a busy man right now, so I appreciate you making the time for us this morning. Thank you.
Hey, thank you very much, Rosemary.